Time for the KSL In Depth. Today is World Sickle Cell Day, and health experts say sickle cell disease disproportionately impacts African American communities. Joining me live in the studio is Chief Medical Officer at Health Choice Utah and President and founder of the Black Physicians for Utah, Richard Ferguson. Richard, thanks so much for being with me today.
Yeah, happy to be here and talk about sickle cell.
Yeah, tell us, how does this disease impact the Black community here in the state?
Well, I guess general sickle cell is a genetic blood disorder that affects the structure and function of the red blood cells, and it causes them to sickle. It's most common in those of African, Middle Eastern, and South Asian descent. But it is primarily impacting 1 in 10 Black births in Utah.
Mm-hmm. How does this further healthcare inequality in Utah?
Well, I think the biggest thing is many of the trainees and doctors and physicians here in the state, because there isn't a large community or presence, we're about often, depending on which statistic you look at, 1.8 to 2.1% of the population. And so the healthcare system, the infrastructure itself, often isn't as aware of how to treat this condition that is miserable for many young African Americans. And I emphasize young. The average life expectancy for anyone with sickle cell is about 56, which has increased. In the 80s, you wouldn't see people living past the age of 45.
So what do we need to see happen to really change this?
I think part of it is discussions and introductions of awareness such as this. So there's about 100,000 people throughout the U.S., about one in almost every 100 births of African Americans will be, throughout the nation, will have sickle cell trait or sickle cell disease. About 1 in 13,000 of those of Hispanic American descent or Hispanic descent. The biggest thing is surveillance and screening. You have couples that do not know that they possess the trait. Two people coming together that have the trait will have a chance now of having a baby that can have sickle cell disease. And then shortly after the blood testing is done, after a child is born, particularly from, say, if it's done at Intermountain or University of Utah Medical Center, that's often a chronic, painful diagnosis for a parent that was not aware and could not prepare. So I think surveillance being done in the state, such as with part of the requirements of HB 487 that Representative Hollins and Senator Plum or Dr. Plum have helped to institute earlier this year. We're also going to need to encourage and make doctors and trainees more aware of treatments. Right now, the only thing that can cure is bone marrow transplantation, but often that has to be repeated, and it doesn't work for everyone. So I think next will be encouraging funding for treatments that involve gene therapy, and also making sure that our emergency providers, our primary care providers, know that this is a painful disease, and educating a parent, an adult that has the disease, on how to best manage it so to avoid these very, very painful crises. I mean, you're looking at a population where you'll have 28, 30-year-old folks that will have strokes, heart attacks, because their disease is not appropriately managed. I mean, can you imagine if you have a daughter or a son that you did not realize if you had the means or healthcare system that I don't even think there's a special sickle cell clinic in the state that can help to manage many of these people.
How do people know that what are some of the signs of sickle cell disease?
Well, often it's diagnosed at birth.
Right.
So I can tell you some of the signs of the crises. So often it's very painful. Pretty much think of an artery as a hose or a vessel. And then when a sickle cell person becomes sick, or such as with COVID, it got very bad because there's increased inflammatory mediation within their body. But something as simple as a cold or walking around outside in the winter can cause a crisis. So pretty much it causes the blood that's in the arteries that's supplying your fingers, your toes, your organs to suddenly clot and block. And so you get what we refer to as ischemic pain. So I would try to have people imagine someone that goes through sickle cell crisis as someone that has like a tourniquet applied to their arm or leg and leave it there for several hours and then suddenly releasing it. And you know that sensation and discomfort you have at that time. Well, that's what someone with sickle cell is experiencing in their organs and in their extremities for often days on end.
Thank you so much for being here today and bringing more awareness to this.
No problem.
All right. And live here in studio with me is the Chief Medical Officer at Health Choice Utah and President and founder of the Black Physicians of Utah, Richard Ferguson.